Hello, welcome to Aware Global Health Media, a platform where we share ideas, systems, and strategies that shape health across the globe. We also share opportunities in global health, including scholarships, funding, and job opportunities. My name is Eric Nitanga. I'm a medical doctor, and I specialize in global health delivery. I recently completed a master's program in global health delivery from the University of Global Health Equity, focusing on health management. Today, I want to talk about a question that comes often whenever I meet people. What is the difference between global health and public health? I will also introduce you to 10 core foundational concepts in global health. So whether you're a student, whether you're a global health professional, whether you're someone who want to have impact on global health, you're on the right place. Stay tuned. Let's start with global health and public health overlap, but they're not the same thing. Whenever I go to any place and I introduce myself, hey, that I'm a global health professional, I studied global health, they're like, something like public health? And I'm like, well, no, they're a little bit different. And the difference lies in the focus. Starting with the public health, you hear people having a master's in public health or PhD in public health. The focus is on improving health in a local community or a country within just one country. So it's about improving local systems, disease prevention, health promotion in that community. For example, improving vaccination program in a certain district is a part of public health. Global health, on the other hand, it's a little bit broader, actually much broader. It goes beyond borders of countries. It looks at health issues that affect countries that just span borders. For example, pandemics. A pandemic like COVID across the globe, climate change, international policies that countries based on to set national policies. All those issues, they're part of global health. One thing that we really focus on in global health is equity. So global health equity is around trying to ensure fairness in global health. Like, for example, if someone lives in the US and someone lives in Rwanda, where you live now, regardless where they live, they have the opportunity to reach the highest standard of health. And global health is the field in which try to bridge that gap to bring equity. For example, I remember one time we were in a class learning about equity, global health equity, and one of the lecturer, Dr. Agnes Binagwaho, he mentioned something really interesting, that your DNA code determines the disease you can catch, but your zip code actually determines how long you can live with the disease. For example, if you're born in Rwanda for now, the life expectancy is around 69 years, but a child born in Japan has the capacity to live up to 89 years. You see, where you're born, there's that gap. So global health focuses on equity, and also global health emphasizes the integration of social, economical, and political systems on how they influence health. So in summary, they all have the same purpose on improving health, but public health is localized in a small community or in one country, where global health looks at the connection on issues beyond borders. Now, let me introduce you to really 10 core concepts that guide global health work. These are the concepts, at least 10, that you have to be familiar with if you think about global health. And I'm going to give you just an overview, but in the subsequent videos and next episodes, I will go in details one by one to give you a deeper understanding. The first concept really we come across with in global health is global health equity. As I mentioned, global health equity is about fairness. How can we avoid these avoidable differences? For example, one of the cases that I remember is when Paul Farmer reached in Haiti, where he worked, there was an issue of multi-drug resistant tuberculosis. People were dying in Haiti because they couldn't have treatment on this TB, which is resistant to usual drugs. But there was a treatment in the US and in other developed countries. And the farmer fought a real battle through partners in health to bring this treatment to people in Haiti. So global health equity is about fairness. How can we ensure that regardless of gender, regardless of location, people can actually have access to good health? So this is the concept that we really work on, global health equity. The second core concept in global health is social determinant of health. So I mentioned about life expectancy depending where you live. It's not because of our biology or DNA. It is because of other factors, social, economical, political, whether you're educated, whether not. All these things that influence health, besides your DNA, your biology, it's something in a global health we look at, because we know that people don't die just because they are vulnerable to diseases, but because their environment influences the quality of their life, the house where they live. So it's an important concept when you're learning about global health, social determinant of health. The third core concept we look at in global health is universal health coverage. This is about increasing access to high quality health services for everyone and protecting people from financial hardship. For example, in 2021, the UNA published a report that extreme cost, what they call catastrophic health expenditures, pushed 500 million people in extreme poverty. So universal coverage is around how can people have access to high quality services, but again without really breaking their banks, their budgets, without suffering these catastrophic expenditures. So coverage, quality, and financial protection are core principles in universal health coverage. And it's an important concept when you're talking about global health. The fourth core concept you want to be familiar with if you're dealing with the global health is primary health care. So primary health care, if you look in Rwanda, 80% of people are treated either in a community or health centers. It's the concept that actually essential services can be accessed at the lowest level of care possible. This increases access so people can have, in their communities, have access to health services. So that's an essential concept in global health, how to increase access to service in primary levels of care. So you also want to be familiar with primary health care. Another concept that we explore more, it's around health system strengthening. You might have heard this. People say, oh, our organization is working on health system strengthening. This is very common in global health because we look at 6 building blocks of health system. It's recommended by WHO that health systems should have health services, also include health workforce. It then includes information technologies, access to information used in healthcare. Then we look at essential medicine and technologies like vaccines and health commodities. Then we look at financing, how people have access without struggling financially, insurance, government subsidies. And then lastly, we look at governance, leadership, how is healthcare led. So this concept of health system strengthening revolves around improving every one of these components, this block, to make sure the system is resilient, the system is efficient, and the system is sustainable. So you want to be familiar with health system strengthening. The next, which is the 6th concept you want to be familiar with in global health, is the global burden of disease. So when we talk of global burden of disease, these are the metrics of measuring and comparing impact of different diseases, injuries, and risk factors actually on health in the world. We use some indicators like what we call DALYs, disability adjusted life years, where we measure how a certain disease actually is affecting people and maybe making them die younger or live with a disease. Or also other factors, other indicators include like mortality ratios. You hear of maternal mortality ratios. So all these ratios, indicators, they help to understand which disease is affecting people the most and where, so that countries and governments can decide to put resources. So when you think about global health, global burden of disease is a very, very important concept you want to be familiar with. The seventh concept that we're gonna explore in this series, in this episode, we will see, it's One Health. You've heard of One Health maybe, but this is the concept which explore how animals, humans, and environments are connected. For example, pandemic. In Rwanda last year, 2024, we had an outbreak of Marburg virus. And researchers found that this virus actually was transmitted from bats to humans. So all these zoonotic diseases. So in One Health approach to understand interconnectedness of human, animals, and environment, things like climate change, it's environmental issues, but it has a very huge impact on health. So you want to be familiar with One Health when you think about global health. The next core concept that we look at in the global health is health security and pandemic preparedness. First, when COVID happened, it affected the whole world. And now the question is, how are our health systems prepared when something like that happened? Actually, how do we even detect? So health security revolves around actually prevention, early detection, and response when any health threat comes up. So it involves really setting up surveillance systems, rapid response, and coordination across the countries on how to respond in the case of a pandemic or a health threat. So it's an important concept, again, when you think about global health, health security, and pandemic preparedness. The next concept you want to be familiar with in the global health, which is the ninth, second last, is health diplomacy. You hear WHO setting targets, what we want to achieve by 2030. So this is not just WHO thing, because there are many members in WHO, and they should agree on that. There should be negotiation. There should be a collaboration. If you talk about access to vaccine, so all these international policies that influence how countries respond to health, it's an important concept that we deal with in global health, and you want to be familiar with that. Then lastly, the concept that you want to be familiar with when you think of global health is global health governance. So global health governance revolves around decision-making processes and how those countries participate. Because we have WHO World Assembly every year, and there's how countries participate in the policies and decisions that affect the international health communities. So it's an important concept to deal with when it comes to global health. You want to be familiar how countries participate, how decisions are made, and how countries and leaders remain accountable in global health. So these are just the 10 core foundational principles, which are going to give you a roadmap, what we're going to be discussing in the next videos. So 10 core foundations. I wanted to give you an overview, telling you the difference between public health, which focus on a country or local community, and the difference when we talk about global health, which looks issues that affect countries and interconnectedness of health issues across borders. Thank you for watching this. I hope this gives you some insights, whether you're students, where you a professional, the ideas can help you in your career. So in this series of Global Health Foundations, we'll be exploring all these 10 concepts. Don't forget to subscribe and turn on the notification button so when we release the first video, you'll be the first to see it. But remember, health is just beyond medical. It's beyond the hospitals. It's social, it's human, it's economy. Everything can affect how people live. It's global. I'm Dr. Eric, and this is Where Global Health Media. See you next time.